Hello everybody. You can start signing in now. We are here tonight, Water Tower Place, downtown Chicago. Beautiful fall evening with our teacher, Sharon Sauer, covering everything that could possibly cause pain that comes from muscles or fascia in the back of the leg and ankle. So we're talking about calf pain, talking about all kinds of problems that could go on. And we're working on pain keys 31 and 34. Here is a picture of 31. You all have downloaded that, hopefully, from the website, myopain.com. Myopain.com. And there you go. Click on Bodyworkers Mastercourse. Scroll down to where it says free materials. And here's the chart that you can put as the background on your phone if you want to be really geeky like Sharon and I. You can get just look at the background on your phone and you'll know what muscles cause pain in every area of the body. And then here is the 60 treatment protocols. These are great to study yourself. Also, they are great to give to your patients, where you'll use your the absolute most important tool of any doctor or practitioner, and that's the trusty highlighter. You'll take the highlighter and you will identify and specify things that are personal for your patients, thus making that information relevant to them. And then leave them with this handout and to take home and do themselves, and go over the protocol with them in your office. And so we would be protocol 31 and 34. And there it is right there, ready for your download. Okay, so hopefully you have all that, and you've got your master charts. These guys right there. Those print out in 11.5 by 17 inch paper for a couple bucks, and another $1 they'll laminate it for you at Kinko's Office Max, or FedEx. And they will create a really nice chart for you to have in your office. You can, also send those to patients and things too, so that they can start realizing just how relevant myofascial pain is in their lives, and how it's pretty much the primary cause of almost most of the pain we experience on a daily basis, which is a revolutionary thought in healthcare, but one that will soon become the basic tenet for, I think, most approaches to care and relief of pain. And without further ado, it is now 6:30. Let us move on to our teacher, Sharon Sauer.
Hi. So today we're going to do back of the leg pain and back of the ankle pain. That's 31 and 34. So there's 60 areas. We're going to finish them by March 7th.
Are there any named conditions that we would know of?
Okay, so today would be restless leg syndrome.
Restless leg syndrome. Oh, yeah, that's one. Yeah,
okay, we're going to help people with that. Also, we'll be helping people with jogger's heel.
What's jogger's heel?
Pain in the heel when they're running, after they're running, jogger's heel.
Is that like those little splinter-like pains in the heel?
Okay, we can have shin splints. Okay, but we could have the posterior compartment shin splints. Okay, you could have lateral compartment or anterior compartment shin splints. So this would be shin splints in the back of the leg. So that's, and then also painful. So also growing pains. I would put down growing pains.
That's right. That is exactly where I felt growing pains all my life when I was a kid. It was right in my calf.
Yeah, right in your calf. You can have growing pains, so that's important. Also, the soleus, which is one of the main muscles in the lower leg, it's the most likely one to cause lower leg pain. Also, is like the second heart pump. So it pumps the blood back up to the heart.
No kidding.
So the sinuses in there. So it also can compress veins and arteries and the nerve, and that causing all kinds of trouble in the ankle and the lower leg.
So like when your leg feels like it's swelling up and it's just not like moving the lymph or fluid or blood back through, it might be the soleus?
That's right. You could have some trouble with your soleus, yes.
All right. And so let's take a look at those two protocols. So here we go, 31 and 34. There they are. 1 and 2. And so 34 has only got 2 muscles. Wow, what a break for you all. Soleus and tibialis posterior. Let's take a look at those two, huh?
Okay, so here's our muscle. This one, back of the ankle pain. There's only 2 muscles, posterior tibialis and the soleus. Tibialis and the soleus. That's the ones that we're going to be doing for that. So we're going to take a look at that, and then the ones causing back of the leg pain would be the soleus, the gluteus minimus, way up in the hip, the gastrocnemius, the hamstrings, the one that goes down to your toes, the flexor digitorum longus, tibialis posterior, and plantaris.
Great,
Yeah.
great.
So those are.
And each one of those, I imagine, have a distinct referred pain patterns, right?
I do. Yeah, let's take a look at them.
All right.
But I was going to
please.
go over. So you see here how the tibial nerve comes down and it can get compressed by here, the soleus muscle, and the runner's nemesis, and it can cause trouble and all the way down into the foot here and cause you to have numb feet and swollen feet and so forth, as well as you can get compressed over here at the tarsal tunnel. So we're going to look at compression right here by the leg muscle, and also down here by the tendons and retinaculum.
So I see this. So the tibial nerve is actually running through.
Right through. It can get pressed by the.
That's just like the sciatic nerve in the piriformis, right?
Right.
Holy
So
cow.
here's the referred pain from the soleus. So it can cause pain in the heel if it's taut bands on the outside of the muscle, but if it's on the inside here, and then if on the outside, it can go up and cause you to have sacroiliac pain, and sometimes it even goes up and causes pain in the side of the face.
Holy cow.
There's some of the exceptional ones. So that's the soleus. So
Soleus, fantastic.
that's the most likely one to cause pain in the back of the leg.
Is it the most likely one to cause pain?
Yeah, yes, also in the back of the heel too. So
For 34 and 31, it's the most likely.
That's
All right.
right,
Well, you
that's
guys better get good at treating the soleus.
That's right. Then the next most likely one is the next one is the very likely would be the gastrocnemius. But the one that's next most likely actually would be the gluteus minimus. So you can see here the gluteus minimus way up here in the hip. It causes pain all the way down into the lower leg and into the back of the lower leg right here. So these ones further back cause it to be further back, and these ones further forward cause it to be further forward. So this is the second most likely. Then the third most likely.
And that's that pseudo-sciatic pain,
Yeah,
right?
that's a pseudo-sciatica.
People think they have sciatica, but it's trigger points in the gluteus minimus.
That's right. And then the third most likely is the gastrocnemius muscle. So here you can see that it causes pain in the back of the leg and plantar midfoot pain, like plantar fasciitis.
Which one? The gastrocnemius? Plantar fasciitis?
Yep, that sure does. So you can see it can cause it to be very painful in the bottom of the foot.
And that's the medial side, the inner?
The inner section here. Yeah.
Gotcha.
Now the fourth and the fifth most likely would be the hamstrings. So here they are, and they cause pain right here as well. So here's the hamstrings, and they cause pain here in the lower leg.
Right. Biceps femoris is on the outside, and that tends to cause it to come
More on the outside, and the semitendinosus membranosus more on the inside.
Gotcha.
Yeah.
All right, that's pretty easy.
Yeah, that's it. And then the sixth most likely one to cause pain would be here the tibialis posterior here, and here you go the soleus. Oh, here's that. The flexor digitorum. Yeah, tibialis posterior. So here's flexor digitorum longus. And this one here's the flexor digitorum longus, and it causes pain in the back of the leg, as well as down into the foot. And the next one would be the tibialis posterior. It causes really bad ankle pain in the back. And so it could make you think you have Achilles tendonitis.
Oh yeah, right over the Achilles tendon.
Yeah, so you could think Achilles tendonitis. So it gives you pretty good pain there, but see, it's a muscle here deep in the foot and attaches right there.
And that's the one that feels like shin splints in the back, right?
It could definitely feel like shin splints in the back.
Because it's right up against.
It's right up against. Right there, and then it attaches right where the arch is.
Great.
And the last one would be plantaris, and so that one is right here. Plantaris is put down there, 429. That's it, page 429.
There it is.
So it'd be right here, and so this is 1/3 actually here. So here's plantaris. It attaches here onto the femur, and then down here to the calcaneus, and
It's
it
one of
causes
the
pain
three that cause
in the back of the leg here.
Yeah, it's one of the three that makes up the Achilles tendon, right? The soleus, the gastroc, and the plantaris both go to the heel.
We go to the heel, but it doesn't. Look, if you can look here, it's not really part of the, it's not really part of the Achilles tendon.
Gotcha.
But it's right next to it.
Right next to it.
Right next to it. It's
Right
right there
there.
next to it.
Okay,
Right,
cool.
right next to it, right there. Yeah.
Uh-huh.
So they're all working. So this is your soleus, and then your gastrocnemius would be right on top of that. So this is kind of your ballerina muscle, standing on your toes muscle.
Yep.
Your ballerina muscle. Yeah.
So these look like the muscles, basically all the ones that flex the foot downward, right? Plantar flexion.
Yes, but there's some like this one crosses the knee. Doesn't do a lot of flexion of the knee, but it also crosses the knee. So does the gastrocnemius.
Gotcha.
So it crosses the knee, so it could do some flexing of the
flexing of the knee as well.
Yeah, as well. Yeah.
Right.
Okay, so those are a lot of our muscles we're working on today, and their preferred pain patterns.
Fantastic.
Yeah. Okay, so I thought we'd take a look at Marcella.
Oh yeah, let's take a look at a patient, eh?
Okay, did I get your name right?
Mariella.
Mariella.
Oh, of course.
Mariella. Okay, we got it a little wrong. Mariella.
Thank you, Mariella.
Okay, so we're going to take a look at her.
Would you like to
Can I
describe?
take a look at your picture?
Oh,
So we have an interesting picture of pain here that she has. She has some pain here in the front. Also, she's got some pain in her feet and down at the bottom of her foot, the back of her ankle, and the back of her leg here. So these are areas that we're working on today. So in the next coming weeks, we'll be working on the bottom of the foot, and the top of the foot, and the toes, and then we're going to go up and start doing the shoulder, and then the arm. So those are all. But we did a few of these, and some of these that you can find on YouTube right now. But we also, some of these up here also cause pain down in the lower leg, like the gluteus minimus. So we're going to look at that today. Okay, so we're going to look at you a little bit and see what we might look at first. Okay, let's take a look at her. So
can we have her describe what?
Oh yeah, tell us a little bit about it. Yeah.
Tell us a little bit about the pain you've been having, how it started, and the severity, and what it limits you.
I would say the injuries, what I call injuries, limitations, are exercise induced. So with the pain in my feet, I have a lot of hard time doing a lot of jumping. I'm really limited in the jumping.
So we want optimal. We want to be able to jump, right?
Yeah,
we do. We want to be able to jump, run.
With a lot of I have a lot of pain also in my IT bands and like the gluteus muscles that I find myself, I sit most of the day at work, and I'm always trying to either widen my seat, with my legs, with my hips, or I'm constantly crossing my legs because I'm just in a lot of pain just sitting straight.
Sitting straight causes pain. Oh,
She crosses her legs all the time.
To alleviate some.
She crosses it one way, then she crosses it the other way.
And I use a stool. I have some ergonomic problems at work too.
Okay.
What does it mean when somebody crosses their legs?
Well, often they have a small pelvis on one side. Yeah. So we could check that. See what's going on there.
You can have a smaller pelvis on one side than the other?
Yeah, you could. It's possible.
And
Or you might have a
muscle
muscle dysfunction such that it makes you uneven, and then you end up it acts like a bony dysfunction. So it could be a muscle dysfunction causing you to want to cross your legs, or a bony dysfunction. So we could look at that and see if you have one of those.
Excellent. Yeah. All right. Thank you very much.
Yeah.
Also, how do you rate it? Can you give us a number out of 10 on your pain right now?
Choose an area.
Okay. What area do you want us to evaluate the most? Or are there 3 areas or 2 areas?
I would say 2 hot areas right now are around the ankles. That is also causing foot pain, and around the gluteus, definitely. Okay, so rating for pain.
Okay,
definitely above a 5.
More than 5. Okay, great.
Okay, scoot a little closer to the edge. Okay, since she had this, it was the story of how she likes to cross her legs, so we're going to see what happens when she crosses her legs and stuff. So let's take a look at her hips. So let's look at the heights of them. And so let's have you cross your right leg over your left. Okay, that makes this side higher. So that'd probably make her uncomfortable after a while. So then let's try your left over your right. Ooh, so that doesn't change. So It's lower on this side.
Mm.
So probably she's trying to even out those hips that by crossing the left leg over the right. How's it feel right now?
I'm okay.
You feel pretty good? Okay, let's have you go ahead and stand up just for a second. And I'm going to pull out something and put it under the left side. So I've got these little lifts of different heights, and I could put them under and see which one corrects her. So I'm going to put a little lift underneath here, 5 millimeters, and we're going to see how that does. Okay, so let's put it under the left side. Okay, so let's see. Now, you know it's a good height for you if you don't feel like crossing your legs. You know, so do you feel like crossing your legs right now?
No, I think I'm okay.
Okay, so do you know that it's a good correction also when you put it on the other side and it makes her uncomfortable? So let's go ahead and put it under the other side, okay? So you put it right under your bones, and it should make her uneven.
Mm-hmm.
Okay, it does, see? This side's way high, and she doesn't like it, right?
Yep.
That feels worse for you, huh?
Right?
It definitely does.
Yeah, she doesn't like it. Okay, let's put it under this side. So here, you can see, go ahead and sit down again. So this is making her even here. Okay, let's look a little higher up and stay there again. I'm going to look a little higher at your shoulders. So right now, she's a little lower on one side and a little higher on the other side here. So it could be that it might be even good to make it, we can see if we put a little more underneath, it makes the shoulders more even. So let's go a little higher. Let's see what happens. Okay, let's go here. Let's go see how's that feel?
It's okay.
Feels okay. And that makes her shoulders even. So this would take away some of the neck and shoulder pain, especially when she's seated. You know, so this would be a good solution for you when you're at your desk, especially in your car too. So whenever you're seated, but we're trying to have optimal health, like when you're exercising, right?
Yeah.
Okay, so that has more to do with standing and stuff because you don't sit too much while you're exercising, I think, right?
No.
Maybe if you're on a bike. Okay, so right now it looks like 7 millimeters would be good on a hard surface. So here, see, this is 7 millimeters. So this is like the size of a magazine, right?
Okay.
So you could put a magazine under one side, you know, or even if it's a softer surface, you could go even a little higher. Okay, let's take a look at you standing as well. I noticed when you were standing that you were a little uneven too, and I also noticed that your ankle was falling in quite a bit here. So Justin, could you take a look here? So you see how her ankle is like falling in here?
Oh yeah.
Now I'm going to show you where your ankle should be. It should be there. Okay? And you see, if I do that, look at how much space there is under your big toe. Okay, so there's a bunch of space. So to make when your ankle is even, then your big toe is way off the ground. So let's look at on this side. Can I have your heel move this way? Okay. So you can see here, if I can rotate your ankle there again. So you're again way off the ground.
Wow.
So so if you take a look at her ankles, just if she wears them, doesn't like she does now, you'll see that her hips are a little bit uneven. This one's a little lower. And her shoulders, this shoulder is lower, quite a bit lower. So this shoulder is quite a bit lower. So one way of helping her would be to see if we couldn't correct the way her big toe is off the ground, okay? And her ankle is falling in. So a really, really good correction. So I'm going to just take a look and put a little bit of, I'm going to put a few millimeters underneath her toe. And everyone could become posture pros. They could learn how to do this. Okay, so I'm just going to put 3 millimeters underneath her foot here. So let's take off your shoes. I'm sorry. Okay, good. Okay, so let's take a look at you barefoot. You can you see how your ankle goes this inward? Okay, so we're going to just make it even. You can see how you're off the ground. So I'm going to just put a 3 millimeter lift there. And then what this is like a proprioceptive device that lifts the ground and brings it to your foot. Let's move this foot a little this way. Okay. And I'm going to put 3 millimeters underneath this one. Okay. Then I'm going to see how it does. How's that feel? So that makes this hip come up a little bit.
Yeah.
And it makes that shoulder come down. So it's just a small change like that is making her more even all around. Yeah. So Stephanie, I was wondering if you could get me some soulmates, and I'll put them on her feet, and then we'll take a look at a couple more things on her, so you can see if you can find them. Okay, so we're just going to start with 3 millimeters, but over time, maybe we'd look and reevaluate her and determine that we'd like more or less based on what we see in the future. Well, so what we like to do is to put a little correction in your shoe, you know, and so we might put something right here to make it a little bit more, so you have more stability. Bring the floor up to your big toe, and then if it was helping your shoulders and your hips. Isn't that incredible? Yeah, so let's take a look at working on that. Okay, so let's go ahead and Stephanie's going to give us that. Go ahead. Thank you, Stephanie. Okay, so let's have you learn how to put these on your feet. Okay, so let's go ahead and put this. Let's give me your foot. Okay, so what you want to do is put this right where the thick part, so the thicker part is right there. So you're going to put that on the outside. So you're going to take the glue off and put it right there, and put the thick part right on that part of your toe. Okay. Let me see. Right here? Right, yeah, that's it. Okay, let's try it on the other side. And then what's good is then after we help her with her problem, then she puts this on and then doesn't keep recreating it. Yeah. Then she can put something underneath that side and stop from hurting and stop having to cross one leg over the other.
What are these called?
These are called soulmates.
And what are all these things like hemipelvis and
this is
first metatarsal deficit?
This is what you call underlying perpetuating factors in myofascial pain syndrome. So the underlying reasons that people have pain and dysfunction. Like every single person that came into the fibromyalgia clinic had every one of the underlying perpetuating factors. And everyone that came into the failed surgery clinic that we had here at downtown also had every underlying perpetuating factor, including this one. And they had a first metatarsal deficit like we just saw, and also they were uneven hips and uneven legs and everything.
So can you make a statement about the relevance of underlying perpetuating factors in the pain that people experience on a regular basis?
I think it's one of the most important things that we do. We should really correct all these underlying perpetuating factors. Otherwise, all the pain keeps coming back. Yeah. All right. So the more we can do it, the better it is.
In fact, was it I think Dr. Janet Travell said something, or one of the...
She said if we only corrected the underlying perpetuating factors, then we'd probably see most of the problems go away.
Most of the pain problems in all people in the world.
That's
wow.
That's right.
Excellent.
So here's, how's that feel?
Feels nice. My feet feels a little bit of lift.
So it feels better?
Yeah,
okay, great.
A little bit of
okay, so let's look at you from the side, too. So let's take a look at here. So good that your ears look pretty good there. All right, so one of the areas that you have pain is the back of your ankle. Okay, so one of the muscles that's important in that would be the tibialis posterior. So we can do a little special test for that.
Okay.
And also we can do a test for your soleus.
Okay.
That could cause back of the ankle pain and back of the leg pain. Okay, so a little test for the soleus. Can I have you do a deep knee bend? Okay, so it would be good if we can get you to come all the way down, a little bit further down.
Okay.
So we're going to, Stephanie, could you get me a measuring tape? So let's go one more time. Let's have you come all the way down again. And so here we're going to measure right from her ischial tuberosity to the floor. And each time she did, she got better the second time. That was really good. So that was so we're just looking to be a little bit better. So see if you even get better the third time.
Sure.
One more time. Yeah, she's pretty good. Okay, so you measure from the ischial tuberosity to the floor. So it's minus 10 inches. Well, that's a nice back knobber tool there. Okay, so that was one of our tests. Another test is, can you stand on one foot? So go ahead and stand on one foot. And can you come up onto your toes onto that foot? And if you're kind of wobbly like that, that's the tibialis posterior. Give you dysfunction. So but you can do it though. Okay. Okay, down. But for optimal, it might be good to be able to stand and not wobble. Okay. Let's go ahead and have you stand on the other one. And this is with the thing that helps you. So it's a little bit wobbly. Yeah. So if we treated the soleus and the tibialis, okay, down, and that was very good. You can stand there for a long time. So we could treat the tibialis posterior and the soleus. Maybe we'd see some improvement there. But another thing the soleus can help you with is, remember we were looking at it earlier? It also can help with pain in the up here.
Oh, that'd be great.
Yeah, so that was up here in the hip, right? So let's take a look at that. So it also can help you with pain up here in the hip.
Mm-hmm.
So let's see if we, now today, did you have that pain in the hip today?
I have it more like across the
A
pocket.
little bit like that, yeah.
Yeah.
Okay, so that could be the gluteus minimus.
Okay.
Okay, so that's another one we could look at as well. So a nice test for the gluteus minimus. Let's do a couple little tests for that. Let's see. One is, can you turn your toes all the way in? Oh, it's a little hard. That's a little hard. Okay.
Yeah.
Okay, so that's your gluteus minimus. That's your everyone try it at home. Can they turn their toes all the way in? And if you can't, I could see it. She was working hard at that. I can see you gonna. So that's one of the tests. Can you turn your toes all the way in? Okay, so let's take a look at that and see if we can correct that a little bit. All right, so I'm going to show you how to treat it and see if you can fix it. Okay.
Should we do the sitting over, the crossover? Did you want to do the minimus?
Okay, let's do the crossover one.
That's
Okay.
the only one
Okay.
I know.
All right. Okay. Okay, let's do that. Okay, so let's do that crossover one. Okay, so let's go ahead and sit down on my chair.
Okay.
Okay, now cross one leg over the other. Okay, so that's two fingers. Okay, so minus 2 fingers. Okay, I'll cross the other leg over, and that's minus about a finger and a half. Okay, so we want to get that you'd be able to cross easier, and turn your toes in easier.
Okay.
Okay, those are two really good tests.
Okay.
Can you show us what your goal is for her with these charts?
Okay, let's look at. So it's really good to know the goal because you want to keep treating. How frequently should treat? Keep treating till it gets better.
Yeah.
Okay. So we're going to do that. So here we're going to take a look at a couple tests that we were just doing. Here's the leg crossing over test, number 51, and this is this is you want to be able to cross over and have no space in between the two legs. You know, so that's a really good one. And another one that we want to be able to do is internal rotation test. We want to be able to turn your toes all the way in and have your toe touch the floor. Like have it really touch the floor. And also, we'd like you to be able to stand up here, the single heel raise, and not wobble while you're standing. So those are a couple. Okay, there's one more. You want to be able to do a flat foot knee bend, and your butt comes all the way down. Okay. So those
All things I struggle with.
so those are a couple of things we're working on.
Okay. All right.
Okay. So it's nice to be able to have all those things working. You know. Yeah. All right. So let's see if we can treat some of them. Okay. So
All right, should we
you've
get
got
some
a
of
nice
these things
ball.
up too?
Okay. Great. So we're going to use these balls right here, and then the rest of you can do it with us. Okay. Okay. Here's a nice ball, and I'm going to. Do you know where your materials are? Is this your materials? Great. Okay, so let's take a look at. We're going to look at the materials here, and can I have a highlighter pen? Okay, so here we're going to treat this muscle right here, the gluteus. So this one here we're going to treat, and we're going to treat it with a ball, a 5-inch ball on the floor. Great, thank you. So here we're going to treat right here, and with the 5-inch ball on the floor. Okay, and then I have pictures of this, how you can do it yourself. You know, so here you've got different ways of treating yourself. I'm going to so this is what you can pick up off the internet. So here we're going to be working right here like this. So we're going to go to the gluteus minimus. Right here we're going to treat that area. Okay, so let's give it a try. And
Do you want us to do this on the wall?
if you would,
Yes.
would you do? It'd be great if you could do it on the wall.
Yeah.
You can do this
Okay,
on the wall.
you could do it on the floor or the wall. Okay.
I don't even know how to do it.
Okay, so we're going to go ahead. Let's see if we can get you to pass those tests. Okay.
All right.
So we're going to go ahead and sit right on our ball, and you're going to feel your greater trochanter, your hip bone. We're going to get right there and get right on it. And look. Now we're going to look for a painful spot. So let's go ahead and look for a painful spot. Can you find any painful spots? You can?
Oh yeah.
You can find a few painful spots. Once you found a painful spot, you're going to hold it, breathe and relax. And we're going to push out some of those painful chemicals that get stuck in the muscle. So sensitizing painful chemicals. And we're going to push it in the blood supply. So let's get, remember you said you noticed how you felt it forward too?
Yep.
So this way, let's go forward and get way where you're right there. Yeah. Remember I said how you felt it forward? Mm-hmm. Yeah. This part here goes all the way down the outside, like right where your TFL is, right where the outside, middle part of the outside of your thigh. Mm-hmm. So just go back and look for the most painful spot, and you get right on it. And push those painful chemicals out. And then when you push those out, then the blood supply with the good nutrients get right in there. And hopefully you get some good nutrients there. Okay, let's go and turn over on the other side. And see if you can find some painful spots on the other side. How you guys doing out there?
Doing good.
You're finding any painful
We're
spots?
finding spots. Yes, we are.
Okay,
We're
well,
finding
Stephanie,
spots.
you're on the curve.
Yeah,
Nice.
How's the curve working?
it's a lot easier.
Good. So now the curve could work. You can show that it's that one. Then you don't have to roll.
It sort of can roll.
A new
around.
product from Pressure Positives, the curve ball.
Love tiger.
Justin, she found her spot.
Oh, this
Okay.
is it, huh?
Yeah. So this is her spot. So what you want to do is, and then you're going to roll a little bit so you come forward. Yeah, a little bit more forward. You get right in here. You're going to get right in there and look around for more painful spots. And you get right in there. Yep,
Oh,
right
yeah.
there. She found her, okay, that spot there would make it hurt in the back of the calf
Yeah.
and the ankle.
Okay.
So that would make, it come down the back, pretty much the back of the calf. Then the back of the calf could activate the ankle.
And when it's tight, it prevents you from crossing your leg over the other like this.
Yep.
Okay, so let's try that the other test, which was if you could go ahead and lay on your back on the floor
Yeah, glute minimus.
and put your toes towards me.
Okay.
Okay, so let's try this one. Okay, so we're gonna see how far you can turn your feet in. So here you can see you can't turn it in too good. Okay, so we gotta get this better and better. See? Okay, so what your test here is, that's it. So you're gonna turn. So you want to be able to. So you know you want to keep treating that part we just treated till you can. When you turn your foot in, it touches the floor. And here it's like 4 inches from the floor. Okay. Okay. So like you know that you're really good. You really fixed it. If you can really, if after you did the work on it, and here's on this side here it's 4 inches. So we'd like to get it to be a lot better. Yeah. Okay. So another muscle we want to treat is the soleus and the gastrocnemius in the back of your leg there.
Okay.
So let's go ahead and I'll show you what to do with that. So go ahead and stay on the floor there. Okay. And we're going to take a look at those muscles. So here we're going to look at the big gastrocnemius here. So we're going to go all the whole back of the leg, all the way up here. And the soleus and the gastrocnemius. So you have the gastrocnemius and soleus. Okay, so so we're going to go ahead and treat those areas. And we're going to use a nice little tool. Let's see what you think of this tool. So tell me if you could put this in the back of the leg right here, and tell me how that feels. Is that too painful?
Yeah.
Okay, that's too painful. Okay, let's try this.
I mean, to put my weight on it?
Yeah.
Yeah,
It's
it's...
too much? Okay. So then we won't do it that way. Here's another way. Okay, so go ahead. You can come like this and you can put like that. Just put the amount. Okay? That's not too painful.
Okay.
How's that feel there?
A little better, but I mean, I still feel the
It's painful.
pain, yeah.
Oh, it's really painful.
Yeah.
Okay, so what do you think? You can use that tool? Try this little one. This is called a back knobber. You put your leg straight, and then you're gonna just move the tool like that in the back of the leg. What do you think?
I didn't realize I had this pain.
She didn't even know. She didn't even know. Okay, so that's a good tool.
This one's more like like a nice introduction to try to help ease my way into.
Yes, yes. So, okay, I'm gonna just do it with you a little bit.
Sure.
So I'm gonna go ahead and so we're gonna get right here and get it right behind the leg here. So you're gonna come above the knee and you're gonna work right there where the gastrocnemius starts. So we're gonna press into it and we're gonna come like this across like that. And then we're just gonna breathe and relax. And then you're gonna come down from there and press in. Pull it to
Where are you at the top of the
right
calf?
there. Yeah, right there. Yeah, push the leg down. Then you're gonna pull the tool like that. So then come down a little bit more, and then pull the tool like that. And then come down a little bit more, and pull the tool like that. And come down a little bit more, and pull the tool. So this gives you this big reach like this gives you the ability to keep coming down and reach more of the leg. Now let's turn the tool this way now. Come in this way. Let's go to the outside. So come now this time. Come this way. Okay. And we're gonna come up high and go on the outside of the leg. Go a little bit higher. A little bit higher. Okay. Put your leg straight down. You're gonna push the leg straight and you're gonna pull the tool like that. And then come down a little bit more and pull the tool. Then come down a little bit more and pull. And come down a little bit more.
If they wanted to add stretch.
So if we wanted to add a little stretch, so you can bring your toe like this. So you're stretching the back of your leg like this. So when you're pressing in, you're stretching the back of the leg. But I have a nice stretching tool that we can use. So this is one way of doing it, the way you just did it on this leg. And you can go ahead and give it a good stretch after you just treated it. There you go, stretching it really good. And then go ahead and point it, and then go ahead and stretch it, and point it, and stretch it. Good. Okay, and a good way to stretch the muscle from the hip that we just treated. We could go ahead and turn your toe in and turn it out, and turn it in and turn it out, and turn it in and turn it out, and turn it in and out. Okay, so let's try another technique on the other side. So let's bring your leg. Let's go ahead and use this tool, and we're just going to put it behind you. Go ahead and bend your leg, bend it here. We're going to go ahead and press right here, then press right here. And come here, press here, and then come down, use your hand and just press like that. Okay. So not using all your body weight. So here we can use different tools. So here we're coming all the way here to the upper leg. We're using this jack shape tool. And we also will use the back knobber tool. And then you could reach, okay, you're gonna come right here. So once you get there, you're gonna press in and hold it. Hold it, breathe, and relax. And then you're going to come down lower. You're going to press in, hold it, breathe, and relax. And you're coming down. Push it in. And go ahead and come on down and press in. Good, and let's go ahead. Now these ones on the outside, they tend to go up towards the hip.
Okay.
So these would be important for hip pain. So the ones on the inside come down and tend to bother your heel.
Right.
Okay, let's come over here. And when you do it, you're just going to hold it and press in like that. You're going to come in here and press in like that. And press in. And press in. Good. Okay, so let's go ahead and let's test and see how we're doing. So you're going to go. Then you're going to see. Can I turn in better? And can I bring my heel towards my nose a little bit better? And can we turn all the way in like that?
So we just treated the tibialis posterior and the soleus, which one was it?
We didn't do the tibialis posterior.
Okay, we did the soleus.
We did the gastrocnemius.
Oh, gastrocnemius.
Yeah, and the soleus.
In the soleus. Okay, great.
But one that you do for standing on your toes
Mhm.
would be the tibialis posterior. Okay.
Okay.
So let's do that one together. So let's sit on let's sit on the chair, and I'll sit on this chair, and we'll use a little stepping stool. Okay, so all of you want to do the tibialis posterior with us. We're gonna you use this little tool. And I'm gonna do hang these tools back to you guys.
Oh, we're using.
Oh, you got some tools.
Yeah, I
Okay.
grabbed some tools.
Okay, so we're gonna take a look at the tibialis posterior. That's the muscle you use for standing up on your toe. So we're gonna take a look at that one.
You just flip back one page.
Okay.
I think you just run it.
Well, okay. Good. Thank you.
No.
Yeah, that's your digitorum book. So it looks like I'll just give us a nice picture of it over here.
Yeah.
So here is the muscle. So we're going to treat this one right here. It's the tibialis posterior. It attaches right here onto your arch. Okay, but it's deep, deep, deep in the leg here. Okay,
Right
so
behind the shin bone.
it's underneath the gastrocnemius and the soleus, the two big muscles. And we're going to go down there and look at it. Then we'll see if you can stand your toe. Okay.
Okay.
Okay, you put your foot here, and I'll put mine here too. Okay, so we're going to take a look at the tibialis posterior, and the way we find it is we're going to find the shin bone. So we'll find this bone here. We're going to go behind it and press in right here, and then we're going to stretch it and point it and flex it and point it this way and point it that way. And we're going to get right into there. Yeah. I'll do it with you. So here, let's go ahead. We're going to come right in here. So we're going to come right in there. Yeah, and point your toe. And yeah, like that. Yeah, we're going to get, and then get a little further down, and then heel down, heel up, heel down, heel up, and down, and up. And come all the way down, down, and all the way down to down to about right here. Right in there, like that. Okay, you try it on the other side. So I'll do it with you. So we're going to start. So you find the shin bone. So find your shin, and you're going to come in just a little bit. You're going to go right on the bone and then towards the. It's like plastered on the inside of the tibia.
Mm-hmm.
So we're going to come in here and just like moving it a little bit while we're doing it. We're pressing in and coming in. And then coming down, keep coming down.
Are we seeing a little pitting there?
Yeah, a little bit.
A little
Yeah.
bit, yeah.
And then down all the way to all the little tarsal bones and the head of the metatarsals right here. So we could move it around a little bit. Looking for painful spots. Okay, so we treated some of the muscles on both sides. So we'll know that we treated enough when you can stand up and you don't wobble, right?
Right.
Okay, and also we'll know when we've done enough of the lower leg when you can do the squat and your butt touches your thigh, touches your lower leg. Okay. Okay, and we could know when you can turn your toes in.
And when you cross over your legs, yeah.
Yeah. And the cross over your legs. So let's go ahead and cross over your legs and see how that is right now. Okay. Oh, it's a little tighter. Okay, it's only one. It's less than a finger. Okay,
All right.
Let's try the other side. You try it. You measure yourself. Okay. So, how many fingers? This one here is more like a finger and a half.
Yeah.
Okay. So we know. So how about? So you have a ball. You're gonna do the ball.
Yeah.
And until you can cross over and you don't have that trouble, okay?
Okay.
Okay. So then let's go ahead and have you stand up. And let's see if you still what we notice. Okay, let's go ahead and stand up and come up onto your toes.
Less wobbly?
It's less wobbly. That was better. Okay, good. And down, and you're going to stand up on your other side and your other toes. Okay, yeah, it is less wobbly. Okay, less wobbly. Yes. Good, good, good.
Yeah.
Great, great. Okay, so and we found that it's good for your posture, your neck and your shoulders if you have a little lift under your first toe.
Definitely.
So there's lots of ways you can do that, but we have some great shoe inserts that you can use for running and other sports. So you can do that. You can go to mortonsfoot.com and see all the different ones. We have the stuff here too.
Okay.
So we've got that, and then also you needed a butt lift. On what side did you need it?
I needed it on the left.
That's right. Okay, so you needed it on the left. And how much?
7?
Yeah, 7 millimeters. Yeah.
Yeah.
So that would be, and
A
you,
magazine.
but you know that for this one, you know the test is, do I want to cross my legs over? Okay, so you know that you got the right amount when you have the magazine thickness under your butt. So go ahead and sit down. So you have the thickness that you don't want to cross your legs. So right now, you might have the feeling. Do you have the feeling like you want to cross your legs?
A little bit.
Okay, so you put this under, and then see, and then you want to see. Oh, do I not want to? Do I want to cross my legs? You know. So it should make you feel like you don't want to cross your legs.
Mm-hmm.
Okay. So you want to put the amount in that feels that way. Yeah.
Mm-hmm.
And this should be helping you with your hips, your neck, and your shoulders and stuff while you're working and stuff.
Definitely.
Now, Sharon, can you show us how you would treat, as a practitioner, would you show us how you would treat those muscles?
Yeah, we could do that. Yeah, yeah. So let's go ahead and look at a couple, something else then. So why don't you go ahead and get dressed and let's take a look at a couple things. Sure. All right, so great.
Whatever order you want.
Yeah.
I just knew we were gonna cover that, right?
Yeah, we will do that eventually, yes. Yes, we will do that, yeah.
Because I liked how you zeroed in on 3 muscles. That was great. That's good.
That was good?
Yeah, because, well, with patients, you oftentimes have to start with 2 or 3 muscles. You can't just, sometimes you can't give them the entire protocol the very first visit, right, Sharon?
Right, that's true. That's true.
We give them self-care on 2 or 3 muscles,
right.
Get them used to the process.
That's right.
And get them used to figuring out the range of motion before and after they do their self-care. If you gave them 7 or 8 muscles, they might be overwhelmed and end up doing very little.
That's true. That's true. So we have a few guests here today. We have Linda. She's been here before. You can stand up for a minute. So
Welcome back, Linda. Thank you.
Welcome back, Linda.
Hi. It's good to be back.
So she's often here. She's a massage therapist too. And we also have Camille, who's been here for almost most of the time.
Yes, I want to let you know that last week I was doing the self-care and it improved my plantar fascia a lot.
Great.
Wow.
So I'm going to keep working on that.
Linda, how about
what we're
you?
doing today.
You started with a lot of hip pain. How has that gone for you?
I'm maintaining on the left, and now I'm having problems on the right.
Yeah, problems on the right. But the left hip that you came in that was hurting a lot, it's better?
Yeah, the impacted one that we figured everything out, and I'm still wearing the insoles.
Great.
Which help me. I'm still able to go up and down stairs without difficulty.
Great. So a nice improvement there.
Yes.
Great.
And maintaining it.
Yeah. Oh yeah, and it's staying that way. Fantastic. Right.
Yeah, great.
All right.
And Tal, come and say hello.
Come on in.
So you're here for the first time.
Yes.
Yeah, come on in here. Keep coming. So you've studied massage before.
I have.
And she's interested in becoming a myofascial trigger point therapist.
Fantastic.
Yeah,
we don't have enough of those.
Yeah, we'd like to do that. Yeah. So today, let's take a look. We're take a look at your lower leg and feet. Okay, so you have a heel pain, right?
Yes.
And you also metatarsal head pain and back of the knee pain.
Mm-hmm.
Okay. So here we got a few pains. Okay, and also lateral leg, metatarsal head pain, arch pain. So this would be gastrocnemius. That would be soleus. This would be a variety of different muscles.
Could be digitoris longus, right?
Yeah.
Digitoris longus.
So this is the peroneal. So we have a lot of the muscles we've treated already. Okay.
Right.
So let's take a look at some of the muscles we're treating today. And we're coming up. We're going to be treating all the muscles in the metatarsal head causes metatarsal head pain.
Oh, yeah.
Coming up soon. Today we're just focusing more on the one that causes heel and mid plantar foot
Great.
pain. Yeah.
Are you
And
gonna
back
do
of the knee pain.
practitioner treatment on these ones? Maybe?
Yeah, I thought we'd take a look.
Perfect. It's
Okay,
great.
so if we could take a look at you for a second. Okay, so often we'll just look at her symmetry, and she's pretty symmetrical. Good. And let's take a look at her hips. Not too bad. And we're going to take a look at her from the side. You sit where you work a lot too.
Yes.
Yes,
I
she
do.
does. She's sitting a lot. And I've taken a lot of people from the sitting world and taken them into the myofascial field. So it's after you've sat for a long time, sometimes you want to do something else.
Like move.
Like move. Okay, so we have a little bit head forward there. Okay, so let's take a look at. Can you do a deep knee bend? She can.
Wow.
She does pretty good. She does pretty good. And so just what do you see?
Shake back.
Yeah. Okay. Let's see if you can stand up. I'm not great. Thank you. So it's one more time. So let's take a look and see how high you can. One more time. So we measure from the. So we got down to about -6 inches there. So that's pretty good.
She's looking smug.
Yeah, it's looking good. So we can improve that a little bit. Let's have you go ahead and turn your toes in. So you're pretty good at that. So how's that feel? Great. So it feels good. Okay, let's have you go ahead and stand up on one foot and come up here. Oh, yes, good. That's pretty good. Let's hold it there a little longer on the other one. Okay, so she's having trouble with that. Yeah. Let's put that one down. Let's stand up on the other foot. Okay, so we've improved the tibialis posterior for that one. Okay, and we're going to measure a couple more things on you laying on the table. Okay, one more thing. We're going to do the leg crossover test. So you're going to sit down. And you're going to cross one leg over the other. Okay, feel how many inches there is there. So how many fingers? 3, right?
Yeah.
Okay, so that shows how tight these muscles are here in the butt. Okay, let's try the other side. Go ahead and measure. How many? 4.
Yeah, the other one was where this is.
All right. The 3 and 4. Okay.
So it's supposed to be like this, right?
Yeah. That's right.
Which one is it?
So this was that's leg crossover test. There it is. It's 51.
Oh, 51.
So leg crossover test. So we're taking a look at that one there. Okay. So let's have you go ahead and lay that on the table. On your back. Okay, good. That's it. So we're going to test. We're going to look at her. So here you can see that we're going to go from the metatarsal head to the table. So it's just a rotation at the hip there. You can see that she's missing about 3 inches. And let's go on this side. And let me just move it that way, okay? And again, it's missing about 3 inches. So it's not a test of how much you can move your foot. It's more a test of how much your hip moves there. And you can see it's about 3 inches on both sides. So it'd be nice if we can get that a little bit better. And let's see, so she has a good dorsiflexion here. So you can see that's more than 15 degrees.
Yeah.
Okay, and then this side here. So straight leg dorsiflexion, that's very good. So you can do that really well. So super great for that. Can I have you lay on your tummy for just a minute? Sure. And here, that's very good.
Fantastic.
That's why she could do the soleus. So this is the bent leg dorsiflexion. She does that really well. Okay, so I'm going to do this one. Bent leg dorsiflexion, very well. So she's good at that. So the ones that we had trouble with were the turning in, so the Freiberg's test, and also the leg crossover test, and the standing on the one toe test.
Right.
Okay, so let's go ahead. Let's take a look at. Have you turn your head to one side here? Let's look at the nerve roots. Okay, let's see how we're doing with that. So not standing, but laying down. Ooh, it's a little tight. Okay, so we want to look L4, L5, S1, S2. It's a little bit on the tight side. So it'd be good if that was a little bit looser.
Absolutely.
Yeah. So one thing we want to do. So if we start here at the hips, that's about L4. So here's L5. So let's start a little bit right here. So let's have you come up onto your hands and knees for a second. And I wanted to set up the table a little different. But I have to say I received a gift in the mail. Something new.
Oh my gosh, it came?
Something
It came.
Something came, a gift. Something came in the mail.
Wow.
Okay,
Oh,
no,
that's
this
cool.
I think it's a gift from Camille.
Yes.
Thank
happy
you very
birthday.
That's the gift. So this is Camille. Tell a little story about this.
Well, it's called the breast protector.
Uh-huh.
And I was just at the massage convention,
Yeah.
and I saw Tom Owens, who created this body support
Uh-huh,
system. And one year I talked to him and I told him, we need an opening for the breast. The next year he had it. So
So this is
I
it.
got this from him,
And so,
ordered it.
thank you. Thank you.
When I was there.
Thank you. Thank you.
Happy birthday, girl.
Thanks. Nice.
It's much more comfortable for women.
Okay, you could try it. You're the first one to try it. Okay, what do you think? Is it comfortable? Okay, so we're gonna look. So here, the reason I use the body support system is I like to put the low back on a little bit of a stretch. Because if you lay flat, it's shortening these low back muscles, and we don't want them to shorten. We want them to slightly stretch, or stretch. You know?
Yeah.
Okay, so here we're going to treat we're going to look to see how much space we have here. And you can see it's a little bit tight, especially here. So we're going to look here. Go ahead, and I'm going to look for some painful spots. So go ahead and breathe and relax, and exhale. Good. And as she's exhaling, I'm going to be pressing in. And I'm going to press towards the spine and away from the spine. And I'm going to lift up. So, and as she's exhaling, I'm going to press in. Good breathing. That was one of the other underlying perpetuating factors. People who have paradoxical breathing.
Yeah, they breathe through their chest and neck instead of their abdomen.
Yes. So that was another underlying perpetuating factor on everybody who failed surgeries.
Oh, well, after you've been in pain, also, you tend to breathe even more. It's
Well,
like
yeah, then you
one
hold your
causes
breath,
the other,
right?
and then and vice versa.
Right. So how do you know if you're doing a good job?
Of this?
You come back here and you go, oh, it rolls better.
Exactly.
So then we know, then we know that heightened tone that also causes it to be painful, tight here, also could be causing trigger points to be activated in the areas that we're treating down in the lower.
Yeah. Camille, that exact thing is called a breast protector?
Breast protector.
Protector, okay.
It's a separate piece that you have to order outside of the regular system.
Right. Oh, I'm going to be so excited.
You'll be more comfortable in it.
That's great. So especially when I get treated.
Yeah.
I don't
It'd be
think
especially good for me.
I don't think women are alone in this category, actually.
Oh, that's right. We all will like this.
Yeah, actually.
We're all going to like that. So we like the body support system.
Yep.
And so we're going to go ahead and take a look here. Oh, better. So that's better. So we did do a little bit of improving there. So we're looking a little bit at the rotatories and the multifidus right along the spine, and also a little bit the paraspinals. And we're seeing if we loosen those up, we'll actually have more ability to. So I see a little bit more needs to be done right here. So we'll take a look over here. Okay, so if Stephanie, if you could demonstrate the go ahead and do a deep knee bend. Okay. Let's good. So any of you who would like to show, so if you can go ahead and show us what you're doing. So everybody's working on their soleuses and their gastrocnemiuses using the tiger teeth. They're all working on it. They're all trying to be able to do a deep knee bend. And get their butt to the floor.
We all are?
Yeah. Let's see how close they get.
Sharon uses the body support system pretty much all the time, not just for this work. She just didn't have it on the table because of some of the tests that she was doing.
Well, you got to do a test, yeah.
Well, plus we had lots of materials on the table, and those would be rolling around with the body support system. So pretty much she always has the body support system on.
Okay, so we're going to take a look at the gluteus medius, and for this, we're going to look for the
Minimus?
greater the minimus.
Minimus.
I meant to say minimus.
Great.
Okay, so we're going to look at the minimus. So here we're going to look at the greater trochanter, and then we're going to come up from it a little bit, and then go towards the greater trochanter to capture the gluteus minimus.
Can you show us all of them? The glute minimus,
Okay, so
medius,
here's
and
the
maximus?
here's the glute minimus right here.
Uh-huh.
Now the glute medius, the trigger points, the glute medius is over it, but the
Okay.
trigger points tend to be up high, right here next to where it attaches onto the ilium.
And you're pushing up toward
And
the crest?
so usually press up towards the crest to get the medius,
Okay.
down towards the greater trochanter to get the minimus,
Okay, good.
and then, of course, to get the maximus would be right here. So the maximus would be more the bulbous part right here, and then it's going to come down like this. So you're going to catch the maximus when you get the attachments onto the sacrum, and then also come this way and then get its attachments over here.
Camille, you
onto
want to
the
show us
iliatra.
that? You want to show us what Sharon just showed you? So show us where the minimus and medius and maximus are.
All right. Now, which one we were doing?
So try the minimus.
The minimus. We're going this direction.
So here we're going to go ahead. So this is you're going to find the minimus. You're going to find the greater trochanter, and then you're going to go.
Greater
Then you're going to
trochanter.
come up a little bit, and you're
Come
going
up a
to
little
use your
bit,
elbow,
Right.
and you're going to find the greater trochanter. Come up a little bit, and then
Come
you're going to go
up. Right.
towards the greater trochanter,
Right.
Okay.
like
so
that,
we're
like
going
that, like that.
That
Yeah,
direction.
yeah.
So is it
Right.
in and down?
So you're going to find. You're going to
Yes,
feel
in
it.
and down.
You're going to feel it. You're going to come, and you're going to go down towards the greater trochanter, like
Perfect.
that. Yeah.
Because I think a lot of times they
So what
don't
do you
really
think, Tom?
teach you the right way to treat each
Doing
individual
okay?
muscle. Excellent.
So we're looking for painful spots. Did we find any?
I think this feels like it might be a good one.
So which side do you notice the pain on more, the left or the right? More on the right. Okay, and after we do the compression, then we often do a little bit of compression massage. Move it around a little bit. Good.
Right, super.
Now another area we're going to take a look at is going to be the
Thank you,
hamstrings.
Camille. That was good. Sure.
The hamstrings.
Okay.
Okay. So this hamstring makes it hurt quite a bit right here on the gastrocnemius area right here. So we're going to take a look at the medial hamstring. So I'm going to stretch it a little bit, bring it out to the side. Well, we didn't do a good test for this one. Would be if you could
True.
touch your toes.
Oh, yeah, the toe touch, right?
Yeah, that'd be good. We didn't do
Or
that.
lying on your back and straight
Yes,
leg
we
raise,
could do
right?
that. Yeah.
Yeah. Well, everyone knows those. You guys know those.
Okay, so let's go ahead and we're going to treat this over here. We're going to go to the greater trochanter. I meant the issue tuberosity.
Right.
Okay, and we're going to go right there, and we're going to go because they attach there, and then come down, 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 and attach over here, over on the tibia, and on the pes anserinus. So we're going to take a look at that one. So we're going to go ahead, and one part of my anatomy that I use is my elbow, don't I?
Yeah. She's got a magic elbow.
Yeah. Now, one reason my hands don't ever hurt is why? Because I use my elbow.
Yeah, exactly.
Okay, so
Plus, you keep the self-care on your wrist and hand muscles so that
that's
you
right. That's right.
none of your muscles develop trigger points.
Right. So I fix them. So I make sure that I have right angle, a right angle with my fingers. I have this right angle. Always make sure that I hit this finger. I have first metatarsal full function. These muscles have full function. The opponent's pollicis has full function. So I always make sure that all these muscles have full function.
Yeah.
And if I do, then I never have any hand pain.
Yeah.
Okay, well, how about this one? I always make sure that I have the scalene, I can pass the scalene finger flexion test.
Yeah.
So one thing we can do if you're a myofascial trigger therapist is you could hit your elbows and then do a high five and then come like this and then do your you make sure that you can get your scalene finger flexion test.
only if you're cool, though. You have to be a cool trigger point.
So if I'm going to not treat with my elbow, then I always use a straight arm like this. So with all my knuckles and everything in a straight line.
Gotcha. Did we finish the hamstrings already?
Oh, I was coming down that way. I didn't mean to. Okay, got too far down. Okay, here we go. So I'm just giving it a good stretch. So let's do, if you could do your hamstring while we're standing. Yeah, go ahead and do the back. Yes, good. So she's doing hamstring while they're doing the hamstrings while we're treating.
It's a symphony.
Symphony of self-care.
Okay, Tal, if I can have you go ahead and lay on your back for a second. No, just go ahead, just lay on. Oops, sorry. Okay. So I'm just going to test you here. So we're going to go take a look at your hamstring test. Oh, we're missing a little hamstring here. So about a little bit better than 45 degrees. So that's pretty dysfunctional there. And this is the one we just were treating. It's a hair better. Okay, so we want to get this to be a little bit better. Okay, we just treated it. Now we're going to just give it a little stretch. Okay, push your leg towards me, and then relax, and relax, and push it towards me, and relax. Okay, let's go ahead and treat the other one. Go ahead and lay on your tummy again. And come on all the way back up here. Okay, so let's take a look on this side. So we're going to go ahead and treat the hamstring on this side. So we're going to find the sit bone, ischial tuberosity, so everybody can feel where their ischial tuberosity is. Then we're going to come down on the inside, because that's the one that causes the pain here in the lower leg. So here we are, and we're using the elbow, right?
Yep.
And how long have I been doing this? Since 1984.
Right? 84.
Yeah, 84. And my hands are still working, right?
Yeah.
Is that great?
Yeah.
So your hands can keep working too.
Absolutely.
Oh, and by the way, the middle of December, we're going to start the hand and arm pain program. So we're going to start the front of the shoulder, the back of the shoulder. We're going to start with the hands. So I want everybody in the whole world to watch, so they can all watch and learn how to get rid of hand and arm pain, hand, shoulder, elbow, thoracic outlet syndrome,
Carpal tunnel.
Carpal tunnel. Everything wrong with the arm.
syndrome. Bursitis, tendinitis,
Every kind of
golfer's
tendinitis.
elbow.
Tennis elbow, golfer's elbow, tip of the elbow. So every kind of elbow pain. Okay, good. Oh, that's heel to the seat. That's a pass
That's
on
a
that.
good on that, huh?
That's a pass on that. Okay, almost heel to the seat on this one. So that's
Yes.
pretty good.
Interesting mix of nice passes
Good
and
passes
really bad.
and then bad passes and not passes.
Passes and
Yeah.
not passes.
Okay, so one of the ones that we found was pretty good was her gastrocnemius soleus.
Yes.
So that was very good. One that we found we had a little trouble with was the tibialis posterior.
Yes.
So let's take a look at that. This was the tibialis posterior right here. So for this, let's have you lay sideways. Okay. So we're going to change your position. So we're going to have you come up on your hands and knees for a second. Okay. And if you could turn sideways and face that way, you put your shoulder in this little crevice. Okay. So we have So how's that feel? Good.
And after this, we'll take a little break.
Okay. Okay, we'll do it.
Well, you can take a nap. You won't have to move.
Okay, so here's for the tibialis posterior.
So let's see. Where's the shin? The shin is right here. So it's
So-
right behind the shin, huh? Like right there.
Yeah, so we're gonna find the shin. Then we're gonna come just posterior to it, and we're gonna press down and then towards
Towards the shin.
towards the shin.
Nice. Yeah, the tibia there. Right. So just like the anterior tibialis attaches all along, it has every kind of attachment along the entire anterior tibia. This has attachments along the entire posterior tibia.
Oh, great! Can I have
This
that
is
nice
what you're
picture?
looking for.
That's it. Okay. So here's it right there. So we're going to go ahead and then it's going to attach down here onto the metatarsal heads and to the tarsals, metatarsals. So what do you think of that? You notice it? Or just take your shoe off. So here, I like to get in and then sort of shorten it all the way and then lengthen it all the way. And then shorten it and then lengthen it. And then getting right in there. And then going to shorten it and then lengthen it. And then shorten it and lengthen it. Now, what if somebody had leg cramps?
Leg cramps. Which muscle would that be? Well, vitamin E.
Like, so the leg cramps would be the leg cramp muscle. That's which one is it?
Oh, come on. Gastroc?
That's it. That's it.
Okay,
That's
okay,
it. That's it. That's it. So that would be the calf cramp muscle.
Yeah.
So we have to treat that calf cramp muscle. That's for someone who has. Okay, how about you have restless leg syndrome? Now, what if you have calf cramps, and then you lay your leg onto the bed? Then it might cause you to have restless leg syndrome. Yeah. So so that's definitely.
So gastrocs again?
Mm-hmm. Mm-hmm.
Plus, I think it feels good to treat hamstrings too with restless legs.
Oh, definitely.
Yeah.
Especially anything you lay on. So
Yeah.
whatever you're laying on,
Yeah.
most likely that should be treated. Anything you're laying on.
Good
Yeah.
point. Exactly.
Because those look for painful spots, and then treat those. Yeah, and then
yeah.
probably they won't bother you when you're trying to sleep.
Yeah. Yeah.
Yeah.
And maybe talk to someone about vitamin E. See if you need some.
Well, whatever you're missing is important.
Exactly.
So,
Find out what you're missing.
Whatever you're missing is going to be the most important.
Yeah.
About magnesium.
Okay. Well, that could be very important. Sure.
Yeah,
And,
yeah.
what if you're missing iron? That could be very important too.
Extremely.
So,
Oh, yeah.
so it could be many things a person could be missing. How about D? Oh, D might cause it. So, whatever you're missing, that'd be important to check out. Okay, let's have you turn over and lay your other side. Okay, let me take that one off. These are good shoes. Yeah. Okay, so here we're going to take a look at the muscle again. So we're gonna find your tibia. So then you're going to come just posterior to it. So you're just going to find it, and you're going to come just posterior to it, and then you're going to come forward onto it like that. So we're going to get right onto it. So I'd like to shorten it all the way. So here I'm bringing where it attaches towards where it begins. So I'm going to shorten it all the way. Then I'm going to lengthen it all the way. Shorten it all the way, lengthen it. Then you get in deep there, then you're stretching it. So you're going to go in deep, and then stretch it. And then go in deep, and stretch it. And all the way to where it attaches.
Is that the cuboid or navicular or something? That
Yeah,
attaches right there?
navicular,
Okay.
and so some of the other tarsals, and also the metatarsal heads.
Great.
So come right here, right there, right on the metatarsal heads.
Yeah. And so this, along with a couple other muscles, really important for keeping the arch nice. It lifts the arch up like the.
Yes, it does. And also the tibialis anterior,
Yeah.
and the fibula longest,
Yeah. Peroneus longus.
peroneus longest. Well, some people like to call it the
Fibularis or
the
something. It used to be
fibularis.
called that or
Yeah.
something.
Yeah, they do. Why?
They
Because
do.
they don't want you to get your peroneals mixed up with your perineals.
Yes.
And I was listening to a guy on the internet going, "Not for you have to get your perineals if you're going to get rid of your foot pain." You just go like that. And so some people felt that maybe we should change it and call it the fibularis.
Yeah, I
So
like that name much
So
better.
I got it in my head, the fibularis.
Yeah, it's a better name.
Yeah,
Because this is the tibialis,
yeah,
and that was the fibularis.
yeah. Yeah, so I've heard it many times. You get the perineals getting mixed up with the peroneals.
And if you get it functioning really well, it can be the fabularis.
Oh. Okay.
Oh, dorky trigger point humor.
Okay. So let's go ahead and lay on your back again. Okay. Trigger point humor. Okay, so we want to see how we're doing. We're turning your toes in a lot better. Look at that. Okay.
Uh-huh.
So that was one of the muscles we were treating in the hip.
Yeah.
So here we went down to about 2 inches now, And here, whoa, we've got this down to 1 inch on this side, so we improved a lot. So for you, it'd be important for you to treat the gluteus minimus.
Oh, yeah.
That's going to help you. Wow.
Yeah, then get your legs across or
Yeah,
all, you know,
yeah, probably
completely.
they're going to cross now.
Yeah, exactly.
Okay, so let me just look at your hamstring. Okay, so that's better.
Oh, yeah.
Go ahead and push
I
towards
like
me.
better.
Push
Yeah, I can see
and
it right
relax. And push and relax. And push and relax. And push. Good. And relax. And push. And push. Okay, good. Let's try the other side. So coming along, coming along. And you're going to head and push towards me. And relax. And push. And relax. And push. Good. Okay, so that was good. All right, and I'm going to just have you turn your foot out, turn your toes outward. So turn out. And let's go in. And turn out. Good. Okay, so you're doing that really well. Okay, turn out. Turn it all the way out. And turn in.
You're just providing some counter resistance, right?
Yep, and turn out.
Get
Good.
this
And
full
turn in.
contraction of the muscle fibers.
And turn in. And turn out. Good. Super. All right, so we're going to give you another test. Let's have you go ahead, sit up for a minute, and then you're going to wait for a second, relax. And I'm going to take the table down. Okay, let's see if I can do that. No.
Then you have to give her a parachute.
It's coming down.
Okay.
Okay, let's go ahead and have you stand up. Good. Okay, so let's go ahead. Let's do your deep knee bend again. With your heels on the floor. So keep your heels on the floor. Okay, good. Okay, here, so we're going really good here. So let's go ahead. Okay, now we get about 4 inches. Okay, good. Go ahead and stand up. And how's it when you turn your toes in this time? Good, that's very good. Really
yeah,
good.
looks good.
That's it. Another thing we're going to have you do is you're going to have you sit, and you're going to sit with your legs crossed again.
Yeah, she cannot do it.
Oh, she can't do it?
No, she can't do
Okay,
it.
go see how many fingers you got there.
Lot less?
Yeah.
Okay,
Oh,
let's try it on the other side.
I never thought.
Yeah, greater now.
Okay, how many now?
It's 3. Before it was 4.
Okay, good. So you know what you need to do. You need to do, so you saw what you were doing before?
Mm-hmm.
So we're going to have you roll on the ball on the floor, using this,
Mhm.
right? And do you have a nice ball like this?
I do.
Yeah, good. Okay, a tennis ball you can use on the floor or the wall. Okay. And you got your protocol for treating
Yes.
yourself. Okay, good. Okay, so so you did really good.
Thank you.
Yeah. So you improve a lot with self care and with treatment. Yeah, that's good. All right, so
Everybody?
we're gonna have a little break.
Yeah, we're going to take a 10-minute break, so 7:55. We'll be back 7:55. Thank you, everyone.
Jeopardy music while we wait 10 minutes.
Jeopardy music.
They took our program off the music that was whatever reason.
It blocked our
We
YouTube
had
video.
to take the music off.
Oh, wow. Oh, because it was copyrighted?
Yeah.
Yeah, it was a Led Zeppelin song.
Copyrighted, you need to have permission to use music?
Oh, Zeppelin song.
Yeah.
Yeah.
Yeah. You need to have permission to use it. so many people touch me at once.
All hands on deck.
I've taught massage classes where I've had 4 or 5 different people on me at the same time.
Oh,
I would
wow.
say, this person do this person do that. I have to keep them straight. We should take measure.
Well, where is it?
I wanted to measure this for her so she knows how many inches she's sitting at.
Oh, yeah, that's
So she
good.
knows.
How many, inches, how many millimeters compared to
Yeah,
inches?
yeah, compared, because you don't.
So
you
on a
don't
softer
know.
surface, you might put in a little more.
Okay.
Yeah, but on a harder surface, but like if you were a piano player,
Yeah.
you'd have a piano, you'd have to have 7.
Yeah.
So it's
Exactly.
about a half inch.
About a half inch, yeah.
Because we don't think of
No, we don't. But I do.
You do. So
Let's say, I don't know. So when I've been having these issues, one thing I noticed, another way I can like describe it, is a lot of congestion.
Right there?
Here,
Yeah.
where like my foot cracks so much there. Like I feel like it gets stuck.
Yeah. So it gets stuck like that.
Those
so,
feelings.
so like whenever I do like the ballerina stand thing,
Yeah.
like that's
That's
where
the front. So that's the one we just did. But we'll be doing this one coming right up. So this one would be that part of the foot is 37.
yeah.
So you can download 37 off of our work.
Okay.
So this is all the muscles in the front of the leg. So all these muscles here, we'll be doing this. This is coming up. So we're on protocol 34. So next week we're going to do 35.
Give the world a blessing, and almost like a prayer, it can help a healing start.
So somewhere. Okay, let's see where it is.
Even if you're small, inside you have it all.
Oh, there it is. Okay, immediately. Okay. Oh, we did 35 already. So then we got to 36.
You give your smile.
So anyway, you can. So we'll be doing a little bit more of that coming right up. 36. Okay, so that's heel pain.
How are you feeling now?
Feel good. I mean,
Does it feel better in your like lower legs?
yeah, yeah.
Painful, I'm sure.
Well, no, actually, I like the deep tissue work.
Yeah. Yeah.
Oh yeah, it was really good.
It looked painful to me.
When you give your
I've had
smile,
when I was on, I went to therapy for some issues 2 years ago, and like obviously hands-on treatment helps me.
almost like a prayer,
So much.
can help a healing
Did
start.
you have a physical therapist?
Yeah. I've been trained in it. Oh my gosh, I haven't. It helps so much.
We're on 35
I just
today.
haven't experienced so much tension and pain because it's like the needle where it's at in the trigger point, it causes
It's more than just a
and it's
smile.
Yeah.
but it's like you feel relief from there. It's just like excruciating pain, twitch, natural twitch, and then like relief.
It's, sometimes I think people get either have like involuntary muscle reactions or twitching or whatever doing the trigger point work. I mean,
Wow,
I
really?
yelp and make all sorts of noise. I mean, when it's like I can't. It's involuntary. It's involuntary. It's just like the noises will just come out of me. You know, and I can't understand how anybody could be quiet when.
It relaxes me. The funny thing is,
Yeah.
I'm the opposite. The more you person, the more it relaxes me. Really.
But it's not. Well, for me personally, it's not necessarily requiring that much pressure.
You say you just can't
It's just
find.
making contact.
You've been
with the trigger point.
searching high.
Yeah, it can hurt.
Irritable. It's like
From one place
I just have all these
to another.
involuntary
For the
noises come out of me.
truth you want to know.
You know what?
So
I
intense.
can remember like
white
I like
winged
it was for me. I remember like we always
You
want to
look
scream
for
because like you don't,
other answers.
you never have someone just doing that to you
Different
and see you have it, you know, and then when it's suddenly it's like, oh,
You say you just can't hear me, though I'm
Because a lot
talking
of
all the
times the
time.
feel, because you know it's
Just listen, and you'll know me
nervous system too.
in
It
a
actually
room
feels
or in a ride.
like the whole,
yeah.
In the
or like there's a fire
questions
in
you
there, there's hot fires in there.
Yeah.
and in more than you
Oh, yeah.
can see. I'm right here with you always.
Yeah. Everything's right at the surface for me, so I don't require a lot of pressure.
Oh, see, and I need dynamite.
I am.
I'm serious.
I am the rain.
I need dynamite.
I am the love and all your pain.
That's what
I
you
am the earth. I am the air. I am the hope in your despair.
just
I am everything, everywhere.
a myofascial for my therapist.
For this conference.
Because you're
You
friends.
say you just can't feel me. There's an emptiness inside. You just can't tell what's missing. Yet I know how hard you've tried. In the thrill of every lover, in the joy of every friend, it's through their touch I'm giving the love that's within. I am the wind, I am the rain, I am the love and all your pain. I am the earth, I am the air, I am the hope in your despair. I am everything, everywhere. You only have to realize your yearnings are my own.
Oh, that would be a
That
one
still
minute
small voice inside of you, the one you always know. I am the
Yeah, that would not.
That's trigger point, right?
You trigger point. We roll
I
over
am the earth, I am the air.
Feels so good when you stop.
I am your friend. I am
Okay, the next class we're going to do 36 and 38. So it's heel pain and then yeah. So
I
it's the same.
am
I said holy cannolis.
Holy
cannolis. That's me.
Cannolis. You're gonna bring cannolis next. She's gonna bring cannolis next.
I don't know what I'm gonna canoe. I don't know
They
how
gotta
to
be
canoe.
holy
You don't have
cannoli.
to canoe. You just go to the bakery. We got good ones at Mariano's.
Cannoli?
Yeah.
Really
In fact, they
good
have a cannoli dip, but it costs too much.
Is that Italian or is that
Yeah.
Polish?
It's Italian.
Cannoli dip. There's such
Yeah.
It looks like a
yeah.
nacho platter.
Yeah.
Really?
Yeah, they have just the insides and then it's the other one. Top part is like chips.
Sweet cheese. It's a sweet big cheese, right? That's what you tell.
I can always put a few minutes of muscle neurology,
Going
going over like,
I don't care about the chocolate chips, but I love the
you know, the science behind muscle testing and
And they actually just
muscle neurology. I can always do it whenever you want.
Really? And push them off it.
Okay.
peanuts are cheaper. Pistachios are super expensive.
So they dye their peanuts green.
Yeah, it's like a
Like the Chicago River. On St. Patrick's Day.
Blue. We did it blue.
For the cup.
Hey, they did it blue, right?
Yes.
Yeah. Did you go to the parade?
I was
You watched
around.
it on TV?
Yeah, I was around because we didn't
Oh.
let it.
I stayed
Came
home.
right by here.
All right,
I stayed home
everybody.
because I would not be able to function, drive,
It'd be too
because
much.
I live right there.
We're looking at posterior leg pain, calf pain, and then posterior heel pain. Or posterior ankle pain, I'm sorry. So posterior leg and posterior ankle pain. Next week, Sharon, what are we going to be covering?
We're going to be covering heel pain
Ooh,
and
a lot of
foot
people have
pain,
heel pain.
like plantar fasciitis,
Yeah.
and heel pain.
So
So,
anything from the heel to the midfoot.
That's it. It's going to be incredible.
All
Yeah.
right.
And if only some of the bulls would come in.
Yeah. If only.
We could treat their midfoot pain.
Yeah. Yeah. Great.
That would be great. Yeah.
So what muscles do we still have covered? Let's see. We looked at the soleus. We've looked at that at many
Let's
different
look at
classes.
the flexor digitorum longus.
That's right.
And let's look at the plantaris.
So those are the toe flexors, and there's a longus and a brevis, right? And the longus is like
This would
all
be
the way
the claw.
up.
This is known as the claw toe muscle.
It goes all the way up, you
And then
know,
all the way
to
to
the
the
top of
toe.
the, yeah, and all the way down the toe. And the brevis is just in the foot, right?
Yeah.
So the brevis doesn't go even past the ankle, I don't think, right? So the flexor digitorum longus goes all the way up the back of the shin. Amazing.
And here's the pain pattern that it has. So it causes some midfoot pain and some metatarsal head pain, but also it causes pain here in the back, and it can cause what seems to be tarsal tunnel syndrome because it causes pain here right over the tarsal tunnel.
Which goes right behind the medial malleolus.
Yeah,
there.
behind it, yeah. So let's take a look at that, and let's do a little test for it, and then we'll come down and treat it and see what we find.
Okay, fantastic.
Okay, yeah, so let's take a look. Let's see if we can do the bent leg dorsiflexion test.
Okay.
But add the toes in.
Yeah.
So should we take a look at yours? Take a look at yours?
Let's do her.
With hers? Take a look at hers? Okay. Okay, take a look at yours. We'll take a look at yours. Okay, let's come on over here. And we're going to have you lay on your tummy. And then the other place, right here. Can get your feet, yeah, good. So you can have your glasses in such a way that you're happy with that. Okay, so we're going to do the little, we're going to do the bent leg dorsiflexion. So here you want to have at least, so you want to get it at a right angle and then do about 15 degrees, and she does have that. But then we also want to then add the toes. So see how she does with the toes. So she's passing, but we're going to take a look and see if we can get it even a little bit better. Okay.
And why is the
would
knee
be-
bent in this one?
Okay. So this would be because it doesn't cross the knee.
Aha.
So that's one reason. And so it's not necessary to add those muscles that cross the knee to it.
Like the gastrocs.
Yeah, particularly.
Exactly.
Particularly, yeah.
Awesome. Okay.
Takes the gastroc out.
Great.
So let's take a look at on this one. And so first you bring it to right angle, and then you're going to go at least 15 and 20 degrees. She goes more than that. And then we're going to add the toes, and she can do that pretty well. So that's pretty good.
Great.
So one way that you can tell whether they're at a right angle is you can have a different tools that we could use. But I don't see them right offhand. But you're right. You could. But first you want to get it at a right angle, then go 15 degrees. Not that tool. Okay. So and then of course you're going to look at the toes in this case. Okay. So here's our muscle that we're working with, and so here it is, and it's going to come down, and then behind the inside of the ankle, and then down to each one of the toes. So I'm going to go ahead and treat it a little bit while I'm stretching it.
So how do you get to that as compared with the gastroc soleus and the tibialis posterior?
Well, one way to get at it would be to, if you know where it is, you go ahead and you're going to go right where you know it is, and then you're going to go ahead and you're going to bend the toes, and you can feel the spot. So once you take it off the stretch, now I'm getting down deep, and you feel that, right? And so I'm right where it is, and now I'm going to come here, and I can feel it contracting right there. So another way is I could have her push her toes against my hand. So go ahead and push your toes, but I can feel a lot better the way I'm doing it. So it can feel like this. You're going to right on it, and I can stretch it and contract it. So here we go. So we're contracting it. We're looking for some painful tight spots, and I can feel that this muscle. Can you? What does it feel like when I shorten it like that?
Yeah, definitely
This is
pain right there.
like a painful feeling.
Yep.
Yeah, and I can feel it like it goes clunk, kind of. Okay, here I'm going to go down and behind the malleolus, the ankle bone.
Her muscle tone is clunk.
Yeah, it's sort of like when you shorten it, it doesn't smoothly shorten. You can feel it stop. It's stopping. It won't. Won't shorten. It like
We're not going any further.
So it doesn't. It won't. I can feel it won't go any more than that. Yeah. They go.
It's very much like you're on her gastroc. Huh?
Oh yeah. Well, you have to go through the gastroc to get through it. But if I'm treating the gastroc, a lot of times I'll go. So if I have some of the calf cramps, then we're going to treat the calf cramp muscle. I'll come like this and treat the gastrocnemius on the stretch. Okay, but what if I want to treat the muscles that are below the gastrocnemius?
Yeah, how do you
get that? Then I take them off the stretch. So I'm right on the muscle. So look where it is. See, right up here. And then I get right on where the muscle is, and then I'm going to go like this, and I'm going to feel it. When I do the muscle's job, I can feel the muscle. So I get right on the muscle. I'm doing its job. And I can feel it contracting and stretching.
Good question.
Yeah. So, and then, yes, I am right on the gastrocnemius, but then I want to focus right on the digitorum. And then I come down here all the way.
Which is deeper in, beneath?
Yes, look at,
beneath.
See?
Yes,
take a
all
look,
the way there.
So here, look at here. So it's underneath the other muscles there. See, it's underneath, and it comes down here, and it goes all to the digits, each one of the digits. And so it's way below the gastrocnemius and the soleus.
Yeah.
Okay, so then we're going to come down, and we're going to take a look all the way down into the digits. So we're going behind the malleolus. That's not too painful though, right?
No, the spot before
Oh.
I was.
We found a spot that was
Oh, yeah.
painful. Okay. Okay, then we're going to go down to each one of the digits. Let's treat it while we're stretching it. So we're making sure that the ligaments and tendons are also, the tendons of the muscle are also, and also she has that callus right here, and that would be from her not having the first metatarsal being corrected. And so I looked where she put it. It probably got moved, but you want it to be right on your metatarsal head, right there. Right there. Okay, so that takes away this callus that she has right
You
there.
can stick them downward onto the shoe too. I do that. It works fairly.
Yeah, yeah, you can put it on the shoe instead of gluing it onto your foot. That's right, that's right. Then come down to each one of the digits.
Until Sharon comes out with her sock product.
That's it.
The slits.
The slips.
To have the exact lift sewn into a fitted sports sock that also could be used in dress wear.
So she has the callus because she's putting more pressure
right
rather
there,
than
right there. Instead of
making-
instead of having the pressure right here and here like a tripod, like the heel here and here, she's been
The pressure
putting
is
pressure
looking
right
like-
there
yeah.
in the center,
Yeah.
and then she's been rotating. So you get a callus here, often one here and here, because of that reason. Yeah. Because you're rubbing here, and then
when she
you're
toes
pivoting
off,
right
she
there.
rotates and gets a callus on
Yeah.
the right toe, and when she heel down, she rolls the side, gets a callus on her small toe.
Okay, so let's see if we did a little bit better. Great. Okay, let's take a look at the plantaris.
Is it like a close-up of the toes with the,
Mm-hmm.
you mean the calluses?
Okay, so here's a little callus right here, and often you get a callus here from having having your foot constantly like rotate in the center, like
Because
here.
the second metatarsal head extends longer. It's longer than the first.
That's not the
metatarsal
only
head.
reason, but it is one reason. Another reason is that this one is not touching the floor, and then you kind of come like this. So that's one reason you turn your foot out. Yeah. But I think the first toe being longer is often one of the reasons that you keep rotating like this on it. Yeah.
Yep.
Okay, so then let's take a look at the plantaris. So here's our plantaris, and it causes pain behind the knee. And we're going to just take a look at that. And here's, it comes down and attaches on over here on the calcaneus, right next to the Achilles tendon. So we're going to take a look at that. So it's going to come over here. So I'll put it the book right here. So it's going to come over here across the knee. And then, okay, thank you. We're going to attach here on the femur and come across the knee and down, 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 attach over here on the calcaneus, right there like that. So to give it a good stretch, we might go ahead and turn the calcaneus right here, and come down. Yep. Okay, so we're going to go ahead and press. Now, remember last week we a couple weeks ago we did the back of the knee with our tools on the floor, and so here, you notice the painfulness of that?
Yep.
Okay, so we're right on it. So here I'm just using my middle finger is doing the work there. And then I just took it a little bit off the stretch. So I'm bending her leg there. And I'm turning the foot, so I'm stretching it a little bit while I'm pressing on it.
So you're externally rotating the foot.
Mm-hmm.
And then you can see it's slightly lateral.
Mm-hmm. And coming down like this. And then I'm gonna come back there and I'm gonna shorten it and lengthen it. I'm gonna just look at it while it's short and while it's lengthened.
She's feeling
She doesn't like short.
She notices the short part the most. Okay. And come on down. And I'm gonna come down to right where it attaches. And that's our little plantaris muscle. So take a look at it on this side. So here, I'll take a little bit off the stretch. So here it is. I'm going to give it a little stretch here. So right here on the plantaris. And I'm going to shorten it a little bit and lengthen it and come on down. What do you think of this one?
Yeah,
Right there, right there. Okay.
Yeah.
So that spot would be about right here on the plantaris. Right there. And I'm just going to hold it. And you go ahead and breathe and relax.
Why do you alternate shortening and lengthening?
Because I'm trying to encourage it. So I'm really, really, really encouraging the lengthening and the shortening. I want to really encourage the shortening and really encourage the lengthening. So that's particularly why I'm doing that.
So are you kind of like re-educating the muscle?
Yes, I am. Yes, I am.
Its job?
Yes, I am doing that. Yes, correct. And I'm noticing if it does do the job. Is it doing the job? I'm asking the question while I'm doing it. You know, is it doing its job? I see, it's not doing its job exactly right. I can see, it's not doing its job exactly right. What should I do to make it do it right? You know, so I'm noticing whether it's doing its job. Yeah, a lot of times it's not. So, and here I found a few dysfunctions there. You could feel it, right?
Mm-hmm.
Yeah, so it wasn't working exactly right. Also, I find a little dysfunction with the gastrocnemius. Okay, she agrees. Okay, so she was saying that she had some mid-foot pain, right? Yeah. So the gastrocnemius could be causing that. So the gastrocnemius, so that would be the muscle that comes up here and attaches onto the femur, and right there. So the part that causes it to hurt here and cause plantar fasciitis would be right here. So let's look at her gastrocnemius picture. I bet you it's right here. There it is. So we're right here, and this comes down and causes it to hurt right in the this is just our class next week.
Plantar fasciitis, yeah.
Yeah, there it is. So that would be, so often I'll treat that a little bit while I'm stretching it, and I could feel I had some dysfunctions right there. You could feel it too, right?
Mm-hmm.
Yeah. So I'm right on that dysfunction that I could feel. So I'm stretching it while I'm pressing on it. If I want to go deeper, I take it off the stretch. If I want to be more superficial, I put it on the stretch. So different depending on what layer I'm trying to get at. That's the way I would treat it. You know. So if I'm trying to go deeper, I'll take it off the stretch more. Okay, so I'm just going to go here and take a look at this little section.
So do you work systematically from superficial to deeper?
Not systematically, no, but frequently I will. I mean, I frequently go superficial first. Yes.
Just depending on what her body is
But
telling
the
you?
thing is that the superficial is there first, you know. So, but I mean, that's not written in stone. but it wouldn't be uncommon for me to do that. And also often I treat the agonist, you know, so the one I treat the muscle and then I treat the muscle and then the muscle that does its opposite job.
Antagonist, yeah.
We got synergists and antagonists,
Mm-hmm.
and then the muscle you're treating is usually called the agonist.
Right. Okay, so we get right on the gastrocnemius again. So we're going to go ahead and treat right on the stretch. Okay, right here. Notice that?
Mm-hmm.
Okay, so let's take a look at how she's passing the test. So here she is passing the test, the gastrocnemius, but I think it'd be nice if she could pass it even better.
Well, the golden rule is still palpation. So
Yeah.
you have referred pain, you have range of motion, and you have palpation.
Okay, push your foot towards me, your toes, and let's stretch them. And let's go the other way, relax.
And if you wanted
And you
to,
go ahead and press towards me, and then relax, and press. So was it bothering you here today, in the arch of the foot? Not today?
Some, more like even on the top of the foot.
Oh, yeah, they were doing that, not this week. Okay.
You have to come back again.
I think I
Okay,
felt
so-
more pain in my, like around my ankles.
Yeah, so the
today.
front part. She was noticing the front part
Okay.
more. So it wouldn't be uncommon that it's good to treat both the front and the back.
Yeah.
So
Right.
the agonist and the antagonist. Okay, all right. We have to do it both. Okay, so that would probably make it better for her. Let's go ahead. Let's have you go ahead and come up on your hands and knees for a minute.
Okay.
And I'm going to take the pillows out from underneath you. You can put your glasses back on. Okay, so let's take a look at the front. Okay, go ahead and lay on your back. So one of the muscles that can cause a lot of trouble in the front. Okay, so how do we figure out how we're going to do it? So she was saying the top part of her foot was bothering her. Okay, so the top part of your foot, remember what number it was?
37.
Okay, let's take a look at 37. Say 37. So which muscles are in 37? Can you see it?
which is 37.
Okay.
Oh, sorry, down there.
Okay, so the extensor digitorum brevis, the extensor hallucis brevis, the extensor digitorum longus, the flexor hallucis brevis, the tibialis anterior, and the interosseous of the foot. Okay, so one of the muscles, the least likely would be the tibialis anterior, and then all these toe extensors, the extensor digitorum brevis, extensor hallucis brevis, extensor digitorum longus. So all these. Let's take a look at those little measurements. Go ahead and lay on your back. So
Getting a preview of future class
So
here.
let's go scoot up a little bit more and put the pillow more under here. Okay. All right, so we're going to do here's the tibialis anterior. That's not too bad. Okay, so we'll take a look on the other side. Tibialis, so you're passing that pretty good. Okay, so let's take a look at the other. So you passed those good too. So you're doing good on the passing.
That's for the peronei.
Yeah, so no, this would be the digitorums. So all these little digitorums here. So she does that good. So she passes. Oh, you felt it though. So
Yeah.
it hurt a little bit.
Yeah, yeah.
Okay. Oh, so how about this side?
Not as bad as the left.
Okay, so this
On
one.
the top of the foot,
Okay,
where do you feel it?
Felt it more strain here.
Right there. Okay, so let's take a look at some of the muscles that would cause the pain there. So let's go ahead. We're going to treat some of them. So we'll treat them while we're stretching them. Okay. Then we'll see if we can pass some of the leg tests better. So we're going to go ahead and treat that. So so here I'm stretching it while I'm pressing on it, the extensor digitorum longus.
Mm-hmm.
So it's right next to the anterior tibialis there. What do you think of that area there?
Higher, I felt the pain more.
Yeah, so it's less down here. Yeah.
Actually, it's getting
Okay, you feel it a little bit there.
Mm-hmm.
Okay, so now we're going to do this test again. So how's it feel in the front now?
It feels okay. I feel the stretch in my calf.
Now you feel it stretch of the calf. Good. It's good. Good. That's what we should feel it. Okay. Good. 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 Okay. So this would be the way we treat the front part. Yeah.
Right.
Yeah. So some of the other muscles that we would treat that cause the pain in the front. Great. Okay. So we'll be doing those in a couple. Yeah. Yeah, we just did that one. Great, thank you. So let's take a look at it. So here's the muscle we just did. Extensor digitorum longus right there. And the pain pattern. Oh, I see. It's not for the pain pattern. Okay. Anyway, here's our extensor digitorum longus. And we were just treating that. And that could cause some of the pain here in the front of the leg. Okay, so let's go ahead. And let's go ahead and let's do a little one of our range of motion tests again. Let's have you stand up. Okay, let's go ahead and have you stand on your toe, on one foot, and stand on your toe, and look down. And stand on your other foot, and stand. Oh, that's pretty good. Okay, and let's see you do your deep knee bend. Very good. So about maybe it's a hair better. Okay, and then you're going to do the little stretch for the front of your foot. Go ahead and stretch it. Good. Oh, very good. And let's do the other side. Great. And let's send you home with protocol 37, so you can be working on that today. That's good. Okay, so let's do. So how's the foot feel right now?
Good. I must say though, it feels like the bones need to crack, but if muscle-wise, it feels better. Okay, so the bones feel like they need to crack.
Yeah. We'll have to do a little cracking then, huh? Like that. Okay, they need to crack a little bit.
Oh, here comes the roller.
So one of the muscles you probably is the muscles in between the toes right there.
Whoa, that's a dirty. That's a killer.
Yeah. So these right here.
Yeah.
So those would be the interosseae of the foot. So in protocol 7, that's one of the muscles. 37. That's one of the muscles. The ones between your toes. So let's take a look at how you might treat those between your toes. Let's go ahead and reach over here. Oh, great, thanks. Okay, so here you could go ahead and treat between the toes. So let's go ahead and go ahead and go ahead and give it a try.
You want to stop me from walking?
Okay, go ahead. You're gonna go right in between the toes.
Oh my gosh. I didn't know that would be so sore.
They are killers.
Oh yeah.
Like I can hardly put pressure because it hurts so much. Okay, so right there.
Yeah, between the toes right there. And then now the next toe. There you go, next toe.
Okay.
So you come down here, so you're gonna come right here and come right in between the toes, right there. And then come right there. And then come right here, and then right here. And right there, and then right there, and then over here. Now, one thing you could do is put on some toe spreaders, and then then that stretch. So that's a good stretch. So now stretch your toes out.
Show me what you do with the jackknife over there.
Sure. I'll do this foot now. Between the toes. This tool is not as pointy, so it doesn't hurt as much.
Okay, so you can put this in between the toes. Get that one between there.
Is there any length of time that you should introduce that and then take it out?
Well, usually while she's treating.
Go ahead and sit on the floor.
Oh, just during the treatment?
Good. There you go. Now it's with the stretch there. Now you're gonna stretch it and go in between the toes, like that. And this causes a lot of pain in the ball of the foot.
Oh no, it's causing it right at the point.
So let's try it on this one too.
Oh my god.
So this is a good way of stretching them every day.
Yeah, I guess so.
And then you can work in between the toes. Now our shoes, what they do is they squeeze the toes together, and then these muscles no longer work properly, and then the long flexors of the toes and the long extensors of the toes and the long flexors of the toes can't do their job right. So here, what you want to do is get in between the toes, and you should keep treating them until it's not painful anymore.
Yeah,
So
you,
where
you
can
definitely,
get those?
you never want
Oh.
a toe, you never want a shoe that squeezes the sides of your foot together.
Oh, it's horrible.
You want to have a very wide toe box.
Yeah. So this is a nice company that makes these, and you can get these in different sizes. But I'd say
Just
you get
Amazon.
small.
Amazon.
Yeah, just call up Amazon.
Yeah.
Go
So you
online.
can't get them at a store.
I haven't seen them in any stores. I did look.
You
And
probably
there's-
could, but
But I
Fleet
didn't.
Feet or somewhere?
None of them had
No?
it. No, I asked for it. Yeah, I asked for it. None of them did. Yeah.
What's it called? Toes?
Yes.
maybe a beauty place because
No, they wouldn't have it at a beauty place.
they have toe sprayers for
Yeah, but
painted
they're
toenails.
useless.
Those are
That's
useless.
just for doing your nails.
That's
Yeah.
not. They don't spread them very much.
They don't spread them very much.
No, hardly any at all.
Hardly at
Yeah.
all.
Just so
Okay,
your
yeah.
nail polish doesn't smudge.
Yeah,
Exactly.
it's basically for your nail polish. Yeah, yeah. This really spreads them like this. So this would be a good area, and this would help to get rid of pain here at the top of the foot, and also pain underneath the foot. Yeah.
Is that why she's developing a corn over here? And I don't know if this
That
is
would
like
be so. Here, remember
another
we put
bunion?
this. We put this here. This creates a tripod so that you don't put too much pressure here or here. It puts a tripod between the heel, the great toe, and the lesser toe, and that would help to get rid of that.
Because these are pressure points, right?
Right, shows that she's probably wobbling in her shoe and causing pressure there. Yeah. Okay, great.
Wow.
There's a
Great,
descent.
great for you to say.
Okay, let's have you stand up. How's that feel?
Yeah.
So how's that feel at the top of the foot here?
It feels less like pressure off of it when
Yeah.
like my toes are spread.
Yeah.
I think I'm still radiating some pain here.
There's
Or you press there, yeah.
there's a desensitization technique I showed you last time. If you here sit on the table. If you take, and you can do it yourself or you can do it on somebody else. Oh, sorry, Sharon. You just pinch where underneath you have your finger and up here.
So you're gonna go the top and the bottom at the
top
same
and the
time.
bottom at the same time. And what blocks pain is a little bit of mechanoreceptor, like when we use that body buffer, it vibrates. So you can squeeze and they can just do a little vibration, and actually you can handle more pressure that way in like a little circular, and it'll ease up. It'll kind of get hot and then it'll ease up. Does that feel like a little more manageable than just pressing in? Then you go to the next one. It's right in there, and then just...
I'm sorry, what does the vibration do again?
It blocks pain. It's a gate theory.
Well, the heat, cold, vibration, pressure all go to the brain faster than the pain message.
Yeah,
So we're meant to have that. So when we move, we don't, unless it's something, so we can overcome the pain.
Yeah.
So heat, cold.
Is that a little bit more manageable?
Yeah.
Right? It's a lot more manageable because this is such an excruciating spot. This one for me is like unbelievable between the second and the third. And so you just give a little tug and a little circular vibration, and you can actually, after that, if you go back in and now try with your tool and push on it and just see if it's a little desensitized.
Okay, go ahead and try it.
Where did the tool go? Oh, it's over here.
Here we go.
Sharon's the worst tool.
Sure.
The finger.
Still pretty sore. To ease up a little bit?
It did, yeah.
Yeah.
Definitely still sore though.
Okay.
Wow.
All right. So what are we going to do next week?
So what does that mean, by the way? That means that those nerves are screaming, cease all function. When they're, I mean, even though you're not feeling pain all the time, if you push on them and they're screaming like that, that means they're sending signals in your nervous system saying, cease all function. And that's going to cause a whole host of problems. So really, you can't have nerves screaming pain like that.
And so I like to treat my feet, make sure they're in really good shape.
Yeah.
And so I often put these on when I'm taking a bath, and so every day I get them spread a little bit, And you can even wear, if they're small enough, you can even wear it in your shoes sometimes. Okay, so next week we're going to get rid of pain in the heel and in the midfoot again. So we're going to do it again, and so we're going to do that next Tuesday between 6:30 and 8:30.
You could probably make a whole practice off that, couldn't you?
You could just
Plantar fasciitis, that's it.
right. That's right.
That is it.
We're just going to fix plantar fasciitis.
Yeah, if you put out a Groupon or something, or a direct mail piece on plantar fasciitis, you will get lots of calls. We did it once in practice. It worked.
Yeah.
All right, so We have our little sign off and some range of motion.
Yes, we'll do it together.
Here comes the part where we all embarrass ourselves together at the end of the show. You're very welcome.
Other foot.
Thank you very much.
Turn your toes in. Turn your toes out. In. Out. One right foot. In. Out. In. Out. Other foot.
You too.
Okay, everybody do a squat.
Group squats. Ooh, that was like a wave.